Hey everybody, this is Dr. Ben Pearl with FitFootU. Today we have a follow-up of 2 treatments that I've done with energy for something we see all the time, plantar fasciitis. In this case, it's centric more to the heel. This is a patient who's a runner. He's done 6-mile runs, 2 to 3 times a week, something like that. And you've had this now for how many weeks?
Like 5 months.
5 months. So it's intracted quite a bit. I did a sonogram, I don't have it to show, but it was significantly swollen and there is some bone edema. This is somebody that's very fit, but also tends to be more in the, not the medium weight, but kind of a heavy muscular build. It's muscle, but nonetheless, it's more weight on the fascia and on the heel. So we tried in order, we tried a radial shock wave treatment, and then we also tried an electromagnetic treatment, which is using magnetic energy. And now, because we haven't gotten any delta in either one of those, we're going to take a pause from energy treatments and we're going to do something called a low dye strap. So here we go. I've kind of time-lapsed this. I put the first strip on. We put a U strip like this. I like to use Luca tape. I don't like using the stretchier tapes for this. I like this to hold up nicely, and if they're a little long, which I like to get them just flush with the cross strap, you just cut them short, because there's a popular tape brand now that I sometimes will use for ITB. We want to make sure we get all the folds out. So there's a little wrinkle there, so we just put more tension so that we get all the folds out. I've pre-cut some strips that we can just lay on. And what this is doing is it's simulating the fascia support with external tape. And Luca tape does not stretch like the KT tape that is so popular. So especially for the fascia where there's a lot of weight, I like to use something a little bit stronger. Now the couple pearls on this, you do not want to get this tape wet at all. If you get it wet, it will start to fall apart and it will create a blister and it will increase the bad hygienic things, because now you've gotten it wet and then when you sweat it's like a perfect mix for bacteria and so forth to accumulate, and that is a disaster. So you want to keep it meticulously dry. What I try to tell patients to get this to last more than just 1 or 2 days. If you can, take a bath with your foot outside the bath and then just wash around the toes. So I'm going to put the finishing strap on here, and then at the last stage what we'll do is we'll make sure that it's not too tight, because sometimes it can be just a little much for somebody that isn't used to a strapping. Now, the last part of what I'm going to do in this particular situation is we're going to try this, but we've already set up a focal shock wave treatment after we try this low dye strap for a while, and that is because I still feel like we need even more concentrated energy to get to this heel, which has a lot of swelling and edema. So we'll see how that those treatments go. We'll see how you tolerate the low dye, and then until next time we'll have an update. This is Dr. Ben Pearl with FitFootU.